The following episode is brought to you by the American Urological Association. This special episode is all about the Society of Urologic Oncology meeting at the 2026 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Kelvin Moses and Dr. Mark Preston, Spring Scientific Program Co-Chairs for the Society of Urologic Oncology.
Welcome to another episode of the AUA University podcast. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education. Today we're focusing on another program that will be held at the AUA annual meeting in Washington, D.C., the Society of Urologic Oncology, or SUO, Spring Meeting. I'm joined today by two outstanding leaders in the field and the scientific program co-chairs for this year's SUO meeting at AUA 2026, Dr. Kelvin Moses from Vanderbilt University and Dr. Mark Preston from Brigham and Women's Hospital, Harvard Medical School. Kelvin and Mark, welcome. It's great to have you both here.
Thank you. Good to be here.
Yeah, having us.
So let's frame the discussion for our listeners. We'll start with what the SUO is and why it matters, then discuss what to expect at AUA 2026, and finally highlight the key clinical themes and innovations shaping urologic oncology today. So Kelvin, I'll start with you. At a high level, what's the Society of Urologic Oncology, or SUO, and what unique roles does it play in advancing the field?
Definitely. Again, thanks for the invitation. Mark and I are really honored to present. The Society of Urologic Oncology is an organization within the urological field focused on research, clinical care, and education for urologic cancers. It's been around now over 42 years. And really the leaders in the field, both in academics and in private practice, are very active within the organization. It is the warehouse or the source for our fellowship programs as well. And that's where the upcoming chiefs will match into their oncology fellowships. And the expectation is that they'll do dedicated research time as well as clinical effort. The goal really is to have a cadre of experts who have done research and clinical work within the field so that patients, when they need subspecialty care, can be assured that someone with SUO designation has the appropriate training and expertise to take care of their urologic cancers.
Great. Mark, I'd love to bring you in here as well. From your perspective, what do you think distinguishes the SUO from other oncology-focused educational platforms within urology?
I think it's the collaborative nature, right? It's been around for decades with the goal of providing a forum, whether that's for training the new generation from, we have medical students through residents and fellows who are coming up through the ranks, and they get to come to these meetings, learn the new science, meet the people who are sort of leaders in the field, and want to provide that mentorship in addition to the guidance of what might be coming onto the horizon. It also provides an excellent opportunity to see what's new in the field. When you're seeing a non-muscle invasive bladder cancer patient on a Monday morning and you're wondering what are your other treatment options, right? We want to provide cutting edge guidance in terms of whether it's up-to-date guidelines or new trials or new studies that are underway, and how to provide the best care for our patients.
That's a great perspective and really highlights, I think, the importance of a multidisciplinary focused community in this space. So, gentlemen, let's turn to the meeting itself. Okay, Mark, and I'll start with you this time. As co-chair of the scientific program, what can attendees expect from the SUO meeting this year?
I think we've worked hard to sort of pull together a program that really highlights some key aspects of urologic care. In bladder cancer, prostate cancer, and testis cancer are the ones we focused on specifically in this meeting. But yeah, you get a good overview across all fields. It's certainly multidisciplinary. We've got insights from leading medical and radiation oncologists, in addition to urologists, to provide a good overview of the disease spaces and some of the challenges that we have in providing clinical care. One of the more exciting first sessions in bladder cancer is looking at EV Pembro, which is, is created a whole new, basically field of sort of opportunities for patients as well as for clinicians, but also challenges in how best to sequence and assess response and provide consolidation treatment. And so I think that one of the exciting sessions that we're going to look to cover over the course of the afternoon.
Great. And Kelvin, building on that, how did you and the planning committee approach designing the program to balance cutting edge science with practical clinical relevance?
Definitely. That's really the key for us, is finding that balance. We wanted to make sure we are covering a breadth of pathologies, right? So as Mark said, we're covering bladder, testis, and prostate, as well as some challenging cases. We also wanted to get perspective from younger members as well as, the senior, more seasoned. So we're bringing in junior faculty who will come in and present on, the 3 papers that most impacted their practice. And that's where we get that practical aspect, especially for the younger ones who want to know, okay, if this new thing is out, how do I integrate that into my work, or how do I use that for my patients? We're also bringing in a somewhat more holistic, I guess, look at care. We're having a session on complementary medicine and how it can be used in the care of our patients. Dr. Viraj Master will be presenting that from Emory. So I think we're touching on a lot of different aspects, a lot of different professional levels of people, the practical, the cutting edge, and really a really diverse, rounded out program.
Just so building on that, I think Dr. Moses says it really well in trying to sort of speak to all different ages and to be able to represent, the younger voices, but also with the Whitmore lecture and Dr. Klein, presenting his, his career story is I think is really an enlightening and inspiring sort of aspect, to sort of start the afternoon and then sort of as it builds over the course to see different providers at different levels and different expertise is I think inspiring for a lot of the junior docs as well.
Agreed. I was going to ask, for the busy clinician who may only be able to attend a limited number of sessions, what would each of you highlight as the can't miss components of the program?
For what is hot right now, I guess is the right term. I mean, definitely our bladder cancer one, for the person who does a lot of cystectomies, what do we do in the setting of EV Pembro, as Dr. Preston mentioned? The other one, though, and this is always a hot topic, is biomarkers. And testis cancer has really changed in the way we're approaching it, whether it's mRNA or ctDNA. So, and that's something that can be easily integrated in practice and can really change your treatment decision-making really from the paradigms of the past. So I think if those were the ones that the busy urologic oncology surgeon wanted to hear, that would be it. Our third session is about smarter screening for prostate cancer. And that maybe our general audience would want to hear that. And it's something that we need to be guiding that discussion, but certainly on a practical level, learning how to utilize biomarkers in the setting of your practice is going to be, I think, a game changer.
So let's move into a bit more detail for clinical themes. We've talked a little bit about things at a high level. Kelvin, again, getting back to you for this one, what are the major clinical areas that are being highlighted at this year's SUO meeting? You mentioned prostate, bladder, kidney. Anything else that might be interesting for our audience?
Yeah, we're going to have a session on surgical management of complex scenarios. We're bringing in Dr. Rob Hamilton from Toronto. This is one that, we always enjoy. We maybe tend to cringe a little bit when we start presenting our own complications or tough cases, but it's really good to see you feel better about some of the challenging cases you do and where you struggle, but it also gives you some good tips and tricks on how to get yourself out of trouble or who to call, or how do you approach this person preoperatively to optimize the operative and postoperative care. So I think that's going to be a really good session. We're going to have Dr. Sam Kaffenberger from Michigan Dr. Bradley Leibovich, we all know, and Rich Matulowicz. So I think it's going to be a really good session. We're going to come up with some great cases and hopefully some audience participation. It's always good to hear, again, from some of the senior surgeons in the room, this is how I've approached this problem, and we've reduced our complications or reduced our operative time or days in hospital. And then also for young urologists, say, hey, I've had this particular scenario and got stuck here. How do we approach that? So we'll have a good session on that. I think that'll be really well received.
Great. Mark, earlier you mentioned, the really new paradigm with EV Pembro among other potential treatments. From your perspective, where do you see perhaps other important shifts that are happening right now in urologic oncology practice?
And another aspect is in prostate cancer, not just in the screening aspects, which we're going to touch on, but also sort of the next steps, like how best to evaluate an elevated PSA. Like the session we have looks at smarter screening, but we've got some fantastic presenters as well there with Dr. Etzioni and Dr. Sprenko and Dr. Albers, who are going to look at some aspects of prostate cancer screening, how best to do it. The guidelines have shifted in recent years now with the earlier age of starting PSA screening, and then making PSA screening better by adding in smart use of MRIs, biomarkers, genetic SNPs, and sort of the combination of those to sort of risk stratify, so you can target investigations and treatments in those men who most need it and avoid it in those who don't, so you can limit the overdiagnosis. And I think that angle I think is going to be key for what we see, most common cancer that we deal with. And I think being able to manage that well is going to be a highlight of that session as well.
Great. I think these are all important points that resonate really across all practice settings. Mm-hmm. So, let's look ahead, all right, towards perhaps innovation and future directions. Mark, what excites you most about what's on the horizon in urologic oncology?
The aspect that I mentioned off the bat, I think it's I do a lot of bladder cancer. So if I were to focus on two areas, one is obviously in the more advanced and muscle invasive setting with EV Pembro, and how best to sequence what we do. We're now, there's going to be a fair number of cystectomies that are not going to be needed anymore because we can, they've been well managed or treated with EV Pembro, and being able to identify who those are in a smart way. And design trials so that we can have biomarkers to identify who needs additional treatment and who doesn't. And then in the non-muscle invasive space, we've been incredibly fortunate as a field and for what we can offer our patients now through new clinical trials and new treatment options that are FDA approved for non-muscle invasive bladder cancer, which is incredibly prevalent and it takes a major hit to patients' quality of life. And so anything we can do to provide more consistent cures or to limit the impact on their life as they go through treatment is I think is very important. And the options now through the we got the CTC portion to wrap up the tail end of the session with some new data on one of our clinical trials. As well as an update, and I think that aspect is incredibly exciting.
Great. And Kelvin, I'll turn to you as well. Which emerging advances do you think are closest, perhaps, to changing day-to-day clinical practice?
I think in the prostate cancer space, we're definitely getting closer with how can we use imaging and genomic data in combination to help stratify even before biopsy, right? So can we biopsy fewer people? Can we make biopsy more accurate? Can we now surveil more people, even though by just histological pattern it may look more aggressive, but genomically it has a less pathogenic signature. So I think we're getting much closer in the prostate cancer space. For the other solid organ tumors, as I mentioned earlier, the use of ctDNA, liquid biomarkers, we're getting to the point where I remember in medical school now, 20, 30 years ago, personalized medicine becoming the phrase. I think we're getting closer to that, where we don't shotgun giving adjuvant therapy if it's not necessarily, or we don't necessarily take someone to the operating room if they've had a complete response based on imaging and markers. So I think really that the imaging and the genomic space are really getting to where we're stratifying patients much more in a much more refined way than just sort of brute algorithm.
And as you both mentioned, whether it's biomarkers, new treatments, whether in the intravesical or systemic arena, I think it's really an exciting and rapidly evolving time in our field. So it's great. So let's close with a practical takeaway, or two, I should say. Kelvin, I'll start with you for this one. If you had to leave our listeners with one key message about the SUO meeting at AUA 2026, what would it be?
Come to the meeting, meet the people. We have great science, and I think with Dr. Preston, we've come up with a great program. But a lot of it is in the relationships, right? Like, how do you set up these collaborative groups? How do you integrate new practices in your practice? So come to the meeting, meet new people, meet some of the old people. It's kind of a family reunion, but take the information that's presented, but then also take with it the people that brought it to you and set up collaborations.
And Mark, I'm going to give you the final word. Okay. What's the one takeaway you want the audience, the clinicians who are listening, to walk away with after attending SUO at AUA 2026?
Yeah, I think together with the SUO, we've designed this afternoon. No matter whether you're a fellow in the early stages or an established urologist who's treating complex cancer patients, I think there's going to be something for everybody where you can take away something real and build from that in your own practice and as part of our urologic community.
That's a great practical takeaway, I think, for our listeners. Well, Kelvin and Mark, this has been an outstanding discussion. I appreciate your time with us today.
Thank you for having us.
Thank you so much. Really appreciate it.
And so both Dr. Moses and Preston have highlighted not only the importance of the SUO, but also how rapidly the field is evolving and why staying engaged with high-quality educational forums like the SUO meeting at AUA 2026 is so meaningful. A key takeaway for our listeners is that urologic oncology is becoming increasingly complex, multidisciplinary, and data-driven. And meetings like SUO at AUA 2026 play a central role in helping us translate that complexity into better patient care. I thank you again both for your leadership and for joining us today. And to our listeners, thank you for joining us for this episode of the AUA University Podcast. For more educational content, including podcasts, courses, and clinical updates, visit auanet.org/university. I'm Dr. Mark Gonzalgo, and we look forward to bringing you another episode of the AUA University Podcast.